Hello, everyone. Thank you so much, Georgia and Hyatt. Um, Hi, changemakers all over across the world. My name is Angela, and as the wonderful MCs mentioned, I serve currently as the Teen Advisor Co-Chair, as well as founding director of my own organization, Artvocacy, an organization using art to advocate for issues like mental health. And today we'll be discussing why that mental health is public health. As activists for the gender equality movement, it is so important for us to recognize that building the future, which is our plenary theme, centers also on promoting mental health throughout our daily lives, and how it's really up to us to focus on what we collectively can do to elevate and normalize this issue. And with me today to discuss this important discussion, we have three phenomenal panelists who I will introduce to you without further ado. First, we have Ms. Gabriella Wright, who is the co-founder of the Never Alone Initiative. We have Dr. Leyla Hussein, who is the founder of the Dahlia Project. And last but not least, we have Maya Enista Smith, who is the executive director of Lady Gaga's Born This Way Foundation. First and foremost, thank you so much to all of our speakers and our audience for joining me in this still stigmatized yet incredibly prevalent discussion, mental health is public health. So we're going to get right into it. Let's start with the basics. So mental health is undoubtedly important to all of you, but in specific, you each all are affected by mental health in different ways. So what does mental health mean to each of you? And this is a question open to anyone, and we can start with the order in which I introduced you with. So, Gabriella, please take it away.
Okay, good afternoon, good evening, good morning to the different parts of the world. I'm going to dive right into the subject. Thank you, Angela, so much. Thank you to all the ladies and girls on this incredible summit. I'm inspired by each and every one of you. I think mental health is first and foremost one of our basic human rights, meaning we need to understand that it is who we are. If we do not have mental health, we do not have a relationship with our own selves. We do not have a relationship with how we perceive reality. And reality is the world we co-create with other beings. So for me, mental health is not only experiencing one's self-awareness, the tools that one needs to navigate this world. So I would call it and reframe it like a mental hygiene. We have physical hygiene, but how do we create a relationship with mental hygiene? You see, that's, the secret toolbox that we all need. We all need to navigate the world. But then there's also the relationship with the rest of the world, to understand and experience compassion and experience empathy and action, understanding that behind every person is an incredible inner landscape. And there are a lot of things that we do not understand about each other. And for me, mental health is understanding and accepting the unknown. And the unknown needs to be translated in a universal language that is really love in action and ways to communicate. So for me, mental health is really the essence of who we are. And then we just add on who we are on the basis of our own mental health. Go ahead.
Thank you so much for that beautiful response. I think we can, in the interest of time, we can hear from Dr. Hussein on what mental health means to you.
Yeah, I mean, just following on from what Gabriella said, it really is a fundamental right for us. But also mental health, for me, it's really the core of our freedom. Because I think because a lot of people assume by living in certain environments, you are considered to be a free person. But if you're not free here, then you're not free. So for me, our mental well-being plays a big role in that, especially we are in a summit about girls' leadership. I want to stress specifically the mental well-being. I like to use the word well-being of girls is absolutely fundamental to living in a better world. So I'm just adding to what Gabriella said. I think it's really, really fundamental, and I'm really happy to know that in such platform we are talking about mental health, and girls' mental health is absolutely something that it needs to be at the forefront of this agenda.
Absolutely, 100%. And now, if Miss Smith, Miss Maya, you can also share some of your thoughts.
Well, Thank you, Angela, for convening this important conversation. You are such an inspiration. And the only thing I would just add quickly is that my colleagues are absolutely correct. It's also not just something that we should talk about in times of crisis. It's not something that we focus on when something's wrong, right? Mental health is a forever part of our lives. And I think that's something we don't talk about often enough. We need to be as proactive about our mental health as we are about all of the other forms of health, and help to reduce the stigma around talking, seeking help, being honest with employers, being honest with our parents. Mental health is not something being wrong with us. Mental health is actually something being right with us. It's taking care of ourselves. And so thank you for giving us the chance to talk more about that.
Absolutely. Thank you for being on here. And 100% mental health is, also about being honest with ourselves. And now moving on to the next question. You all come from such diverse backgrounds. Wright, with Gabriella growing up in London, being an actress and an activist. Dr. Hussein fighting for Muslim women's sexuality rights against genital mutilation and working in psychotherapy. And Miss Maya, working for youth civic engagement in your teen years and as the first director of the Born This Way Foundation, which is incredible. And you all come from so many different parts of the world, so many different stories in which you can all share. But one of the major things is that in these many parts of the world, in so many parts, there is a lack of mental health resources and support for especially young people. Why do you think that is, and what can we do about it?
I'm happy to chime in on that. We'll go
Mhm.
maybe backwards. So I think the Born This Way Foundation did a poll recently where we asked young people to talk about how important their mental health was. And of the young people we surveyed, more than 90% of young people said that mental health was a priority. But of those same young people surveyed, less than half of them knew where to go to access resources and tools to have the conversation, right? So it's in that delta that the work of Born This Way Foundation exists. But I think in general, it's because we haven't yet set up systems. I think Girl Up is a huge exception to that, where young people's voices are at the center of decision making, right? We often ask young people, what's your experience with this issue, but not what are the solutions to the issues that you're facing. And so I think we need to do as much as we can to ensure that young people have an authentic leadership opportunity, not only in discussing the challenges that they face, but proposing and implementing solutions in those areas. So I think that's one of the most critical pieces that can change that dynamic that you mentioned, Angela.
But also I think the issue's also been the language. So I can speak, being African, for example, the word mental health, we don't even have an actual appropriate word to say. I think language is so key. Like, I'm Somali, and the only word we have in mental health is crazy or, psycho. So language plays a big role in terms of why there's a whole stigma around this. But also, even here in the UK, mental health is still a big taboo issue. And I personally feel fundamentally our education system plays a big role in this. And I always, any place that I speak, I always say I spent hours learning about algebra, and I didn't do nothing with it. The 4 things I needed to learn in school was about my well-being, finance, healthy relationship, and how to be an entrepreneur. Those things are not taught, and that's part of our well-being. So giving in terms of young people even accessing mental health services, even talking about mental health, the problem is actually the political system we have in place that doesn't allow for us not just to access mental health services, but we can't even talk about it because mental health is still considered a big, massive stigma. And I think my solution in this is we really need to advocate that mental health should be part of the school curriculum. It should be introduced very early on. I know I have a 17-year-old daughter. We talked about we talk about being in therapy as part of life. I said, you need to check your physical health. We need to check our mental well-being. Even if you're in a good place, I still go back to therapy, and I want to know why I'm in a good place. It's important to really, so we need to normalize, but it has to start at a very young age, and it has to start in our school system. Our education system needs to be challenged, and I think our school system is actually responsible for why we have these problems.
I agree a million percent, Dr. Leyla, because and Maya, it's so important, you know, same thing. I'm the mother of a 16-year-old son now, and unfortunately, my relationship to mental health comes from a tragedy, because my little sister, who was 20 years of age, took her own life 2 years ago, and this was right under my nose. So, I was a young activist, and I still am. But the problem was, and the problem is of today, is that because there's a stigma, and by the way, she was brought up in France, and France, same thing, cultural system, different things. So you see, like you were saying, Leyla, there are so many languages, and there's no common language. Stigma is just, you can smell stigma. It's like filling your senses. And my little sister was multicultural family, this, that, you know, same thing, English, London, French, all this, and was unable, as an artist, and she was singing these lyrics, she was an incredible performer, and she was unable to find the inner language with herself, but she was able to find it with the audience. She was able to express it, and yet under the words of art, we were not able to see her pain. So
and what's so really,
like, No, go ahead, because this is
no, I was
We're
saying,
getting
and this is why, but you said something very critical, you know, even someone in that position, you know, who had access still can't talk about it. And I learned, even I suffer from depression since I was, as a teenager. You know, I've undergone female genital mutilation, other forms of oppression. I've had mental health, and hence why I went into this. But what I've learned early on, as a leader myself, I had to model that position within my colleagues, my staff, in my own home. And I really would urge all of us who are in leadership positions, we need to be the first ones actually to acknowledge we've had mental health issues, because this has been the problem. We like to tell people to go and get help, but none of us actually have. And I remember doing this late last year, a big conference in Africa. I had to tell the panelists, you need to actually come out and you need to talk about why mental health is so personal to all of us. And I think our leaders, and again, with this platform, I'm really happy to see, you know, the leadership really see this as a big conversation that needs to be talked about.
Exactly. Oh my goodness. There are so many points there that are so valid and so important to recognize. And building upon that, thank you all for being so vulnerable. Building upon that, it's so important for mental health to be talked about within the gender equality movement as well. And as just a kind of final question to wrap up, Gabriella believes that building a better future that you all do mention, that includes a commitment to mental health. And especially considering that July is Black, Indigenous, People of Color Mental Health Awareness Month, what are actions that we as young activists and to all of the audience here can do to really elevate this issue and destigmatize the taboo that surrounds it?
I think there are, I'll just start. I think there are lots of things to do. But the most essential part as activists, and I'm telling you, because we must not burn out, okay? So we're addressing our mental health, right? We're addressing our mental well-being. But girls, no burning out. We have no time. Like, you know what I mean? This is, and the mantra, the repetition of this is like, mental hygiene, physical hygiene, these are tools that we need. Wake up in the morning, create a relationship with self. How am I really, you know, maybe take a moment of self-awareness. Use a tool, meditation, you know, use these things that allow your mind to create a movement with itself so that you're not stuck in your emotions, that you're not stuck. And the activism of today, of tomorrow, for you all, and I think we can all agree on this, is being the embodiment of what you want to be. And the embodiment, I want to be healthy, I have a healthy mind, I'm physically healthy, and I radiate kindness, and I radiate, and I'm the expression of compassion. Because the more tender we are within our language, the more we're creating tender relationships with our coworkers, our colleagues, and strangers who might have had a bad day. You know,
and take
very
yourself
simple.
out of non-safe spaces. And I learned that as an activist, because you burn out if you're not in a safe space. Take yourself, and I learned this by, like we would say, if no one's going to create a table for you, create it for yourself. And I spent the last 12 years creating safe spaces for what I need as an activist, what I needed as a survivor of violence. So even recently, we created a safe space for Black women only, because we needed our own space where we can talk about the racism, you know, the patriarchal system we're dealing with. You know, COVID-19 is killing Black people the most. So we needed our own space to be angry. So start creating your own safe spaces, but be very kind to yourself. I cannot stress that enough. I really cannot stress that enough.
I cannot agree more. I could listen to you both talk forever. I think truly one of the best lessons I learned for myself far too late, I'm 36, was to be unapologetic about my self-care, about what it would take to keep me in this work.
Yeah.
I left the previous job because I was pregnant with my first child, and I just didn't see anyone who was willing to be honest with me about the choices and the sacrifices that they needed to make in the personal and professional lives to
Yeah.
the responsibility of the work that we do. And I think absolutely we can't have this generation of powerful girls burn out. So take care of yourselves, take care of each other. I think that's another big, and I think on the mental health advocacy, learning how to have hard conversations. One of the biggest myths is that if you ask someone if they're thinking of taking their own life, you'll put that idea in their head. My father-in-law took his own life, and I regret every day not being more open and honest when he knew he was struggling and asking, right? Because I was afraid that we would
Yeah.
idea in his head. So learn the language, know how to have those hard conversations, share your own story, and model the type of vulnerability that you're asking others to share. Because as you know, all three of us are moms. We have to do that for our kids. And someone once told me that there's no such thing as other people's babies, and I think we would all agree with that. That we need to do
with you.
our babies and everybody else's.
Yeah.
Yes.
And check in with each other. Check in with each other. Always check in. Hey, how you doing? How you feeling? How you getting on? Like really check in with each other's feelings all the time. Yeah.
Mhm.
Exactly. Thank you so very much for that. Gabriella, Dr. Hussein, and Maya, again, thank you so much for all of that, for being vulnerable, and especially for your eye-opening insights. I can say on behalf of many of us here today, we truly understand now why mental health is public health, and why, as the theme of Girl Up, we need to talk about it. Quoting the power phrase of the mental health community and my shirt that I'm wearing, the future that we are building in terms of this plenary and in terms of the future is one that is stigma-free. And to all of our audience members today, you are a part of that future. Your collective voice in these discussions shows that your vulnerability is bravery. And that's what builds not only any future, but a kinder one. Thank you so much to all of our speakers, to the audience, and for everyone who's tuning in.
Thank you.
Thank